Hi, my name is Dr. John Mihal. I'm a cardiothoracic surgeon with Cardiac and Thoracic Surgery Associates here at Penrose Hospital. At the time of your initial consultation, you will meet your surgeon either in the office or in the hospital. The surgeon will discuss with you your particular condition, what the options for treatment are, and why surgery is being recommended. They should discuss with you the details of the procedure, the advantages, disadvantages of a certain approach, and what the risks and benefits of the procedure are. They will also cover the expected hospital stay and recovery following the procedure. Once you and your surgeon have decided on surgery and the type of procedure, the surgeon will explain to you in detail the steps of the procedure, the risks, benefits, and obtain a written consent for proceeding with the surgery, as well as consent for blood transfusion or refusal of blood transfusion. Once you've decided to have surgery, surgery will be scheduled as is appropriate for your condition and the urgency with which it needs to be addressed. It may be with the initial surgeon that you meet or with another surgeon, depending on the surgeon's availability as well as the hospital schedule. If you're seen in the office as an outpatient, additional testing and a preoperative appointment will be scheduled prior to your surgery. For patients that are already admitted to the hospital, additional diagnostic testing will be done while you're in the hospital, as well as scheduling of the procedure while you're an inpatient prior to going home.
My name is Kelly Henson. I'm the surgery scheduler at Cardiac Thoracic Surgery Associates at Penrose Hospital. When the patients come to me, they're generally just have visited with the physician. That flyer that I present to them has the date and time of the surgery is written out for them, as well as the pre-op appointment and the date and time of that appointment. Has the instructions listed on there about where they need to check in and where they need to go. On the other side of the information is information for them about when to stop eating and what to do with their medications. I always give them a copy of one of the doctor's cards with my direct phone number on it so that they're able to call me directly. It does ring my direct line, bypasses the front desk and the answering service, so they're welcome to call even after hours if they have a question they're not sure about and leave me a voicemail.
Prior to your surgery, you will go to the preoperative area. There you will meet with the anesthesiologist and have all of your questions regarding anesthesia addressed. In addition, the nurses in the preoperative area will start an IV, typically in the arm. Nurses will go over your medications and be sure that all the preparations have been made appropriately for your upcoming surgery. As a final step, you will be shaved on the entire chest and abdomen, as well as groins and legs. Prior to going to the operating room, the anesthesiologist may give you some sedation to ease your nerves. After all preparations have been made and your questions have been answered, you will be taken to the operating room where the procedure will be performed. The nurses there will prepare you by placing monitors to measure your heart rate and oxygen throughout the procedure. You will remain completely asleep throughout the entire operation. At the conclusion of the operation, you will awaken from anesthesia in the intensive care unit.
Hi, I'm Julie. I'm a respiratory therapist. When you come back from surgery, you'll see me in the intensive care unit, and I'll be placing you on the ventilator. The ventilator will help you to breathe while you're sedated in the intensive care unit, and approximately 3 to 4 hours is the average time that most of the patients are on the ventilator. During that time, we'll be drawing some blood gases, assessing your breathing needs, making sure that you're comfortable. As soon as you start to wake up, we'll do a spontaneous breathing trial. It allows us to assess the ability for you to breathe without the ventilator. As soon as that happens, communicating with the physician and making sure that you are ready for that tube to come out. We'll be placing on some nasal cannula oxygen that will go with you until you get to the cardiac unit, and then we'll continue to assess that, titrate that off as soon as we can. We may encourage you to do some coughing, which is a little bit painful at times. We'll have you hold a pillow across your chest. That allows you to give yourself some comfort with that and cough if there's any secretions in there. We're right there to help you with that, remind you how to do that.
My name is Nicole. I've been a nurse here at Penrose Hospital for 2 years. I've been taking care of open heart patients for about 6 years now. And when you first get out of the operating room, you will come to the cardiovascular ICU. You will have one nurse for the first 4 hours that you're back. And our job is to work with the respiratory therapist in maintaining your airway and getting you off the ventilator as soon as we can. I will be managing your blood pressure and your pain, and we'll be at your bedside through the whole time, asking you if you're in pain and giving you pain medicines as necessary.
I'm Scott Sims. I'm one of the physician assistants who works here with the cardiac surgeons. Here in the ICU, we will follow you over here from the operating room, and during the operation we'll have assisted your doctor across from him during the entire operation. During the operation, we also, if you have a bypass surgery, we'll be taking the vein from your legs and possibly arteries from your arms to be able to utilize during your operation. That's one of our big jobs as physician assistants. When you leave the ICU, your physician assistant follows your care as well, along with the nurse practitioners who follow up to the cardiovascular unit. You'll be seeing a physician assistant or a nurse practitioner the whole time you're here in the hospital.
I'm John Frederick, another one of the cardiac surgeons at CTSA. Postoperative care after cardiac surgery can be somewhat complex, but the goals are quite simple. In short, we want to get you back on your feet and as close to your preoperative state of health as soon as possible. This involves modifying your medications, controlling your pain with pills, removing any monitoring lines, drains, or catheters, and ensuring that you are eating and moving your bowels normally. Your surgeon will visit you daily and supervise this process, which is coordinated by our expert nurse practitioners and physician assistants. Once you leave the ICU, your role in this process increases dramatically, and we will be asking a lot of you as you recover. Most patients will be walking and eating the first day after surgery. Remaining out of bed for all meals and walking in the hall several times each day will speed your recovery. Coughing, clearing your secretions, and breathing exercises are imperative to prevent pulmonary complications and expedite your discharge. The nurses and respiratory therapists in the CVU will guide you through this process, and your participation will ensure a speedy recovery.
Hi, I'm Marcy, and I'm one of the nurses on the cardiovascular unit, or CVU. When you leave ICU, you'll come to us, and we'll take care of you until you go home. The goal of this unit is to get you ready to go home and get you back to your mobility of your preoperative state. In order to do that, we'll be doing rehab with you, and we'll need a lot of your participation as well as excellent nursing care. So that you know what we expect of you each day, and so that we know what we need to do with you each day, we've put together this board, our Open Heart Clinical Pathway, and it takes a day-by-day look at what we need to accomplish with you. As you'll see, much of it deals with mobility. On the day that you come to us from the intensive care unit, we will have you up in the chair for at least 2 meals, and for the rest of your stay, you'll be in the chair for every meal. We'll also walk with you into the hall, so you'll begin walking probably that first day after surgery. And on the successive days, we'll have you walk in the hall at least 4 times a day with your nurse. We'll also encourage you to deep breathe and cough. And we'll give you a pillow so that you can splint your incision when you cough, so that you protect that sternotomy incision or whatever incision you have from your surgery. We'll give you special teaching related to the incision that you have. We'll teach you how to stand up, sit down, climb out of the bed, cough, and sleep at night. Those protective measures for your incision will last for 6 to 8 weeks after your surgery, so it's important for you to understand what you need to do to help that wound heal. We'll use the incentive spirometer to help you breathe deeply and cough so that your risk of getting pneumonia is low. And we'll ask you to do that at least 10 times an hour when you're awake. You will come from ICU with some tubes and wires, and before you go home, those things need to come out. One of the goals will be to have your bowel and bladder function return to normal. Before you go home, you need to have a bowel movement, and you need to be urinating regularly. We'll keep an accurate measure of everything you drink and everything you void, so that your doctor can make sure you have a good fluid balance going home. Pain control is very important. If we expect you to participate in these activities, of course you won't be able to do any of that if you're hurting a lot. We know that you'll have some pain, but it's important to us to keep that pain at a minimal level. So please tell your nurse when you're hurting so that we can help you.
My name is Sarah Sweat. I'm an acute care nurse practitioner here with the surgeons at CTSA. My job is to make sure that the patients, once they come up from the ICU till the time they get to go home, goes as smoothly as possible. A lot of people, even before surgery, are really concerned about what's things gonna be like once I get to go home after surgery. The biggest thing that people worry about is their medications. And my job is to relieve those fears. So the discharge process takes a whole village, we like to say. We take nursing input, we take input from physical and occupational therapy, as well as the patient and their family themselves. A lot of our patients require some form of rehabilitation. That can take place in many forms. One form would be at home with home health care nursing and physical therapy. Another form would be inside a skilled nursing facility that specializes in rehabilitation, usually for less than 2 weeks. But that can be a good bridge for someone who might not have as much of a safe home environment after surgery. For example, if you need help walking or doing activities of daily living. A big thing that we strive for here at Penrose is that we're involving you and your family in your discharge process. When you get ready to leave, I write a very detailed list that's actually put into your chart, and you get a nice formatted typed list. I tell patients to put that on your refrigerator. And for 2 weeks, you're probably going to be on some temporary medications. Most of these medications are to help you with bowel movements, pain, any nausea if you've had that, as well as we put people on diuretics, which help to get rid of extra fluid from surgery. So it's really, really important that you follow that list exactly. And we'll be really careful and be in contact with you if we need to change those medications, discontinue them, or add medications. So another thing that patients also worry about is when they do get to go home, who's looking out for them? Are they all of a sudden off on their own? The answer is no. You can always call CTSA at our phone number. We have people who are there all the time. We have a call service after hours that gets you in touch with either a physician or a physician's assistant who's on call. During the day, all outpatient issues usually go through the nurse practitioners. So once you leave the hospital, we'll make sure that you have follow-up, both with our surgeons and nurse practitioners, as well as with your cardiologist. Most of the time, you see your cardiologist within 2 to 4 weeks, and you'll see your surgeon usually within 2 to 3 weeks. The reason why I love our program is I feel like it's a very patient-centered program, where the patient is in the middle, is the focus of everything that we do. And around that patient are all the multidisciplinary people who help to take care of that patient. Therapists, nurses, CNAs, various people from case management and social work, all working together with the patient and their family to make sure that they get the best possible care.
Thank you for watching. We hope you feel more informed and more ready for your upcoming surgery, and that many of your questions have been answered. We at CTSA are grateful for the trust that you've placed in us and for the opportunity to care for you.